Hello, I'm Kacie Iuvara with the Power of the Patient Project, and I have a very special guest with me today, one of our new segment anchors, named Elizabeth Linden. Elizabeth has been diagnosed with a medical condition known as cluster headaches. This is a rare disorder which is still not completely understood by the medical community. Patients experience severe and painful headaches that come in cluster periods, commonly at night. Cluster headaches are said to be one of the most painful headaches. Today, Elizabeth is going to share her patient story dealing with this condition. So before anything else, welcome, Elizabeth.
Thank you for having me.
Of course. Can you tell us a little bit about your condition and how you first got diagnosed?
Sure. And hello, Kacie. Thank you for having me through my experiences. And I'm going to read off my script a little bit because it actually has to do with my condition a little bit. It helps me to read off script. Cluster headaches, they're also known as suicide headaches, and it's a disorder affecting what's called the trigeminal nerve. They're typically pain that affects one side of the head around your eye. For me, it's always around my left eye. For some people, it's on the right. And it feels like a hot poker above the eye or in the eye. And it also feels like an axe on your head at the same time. And during an attack, you may see the affected eye droop or tear up. And some patients, it doesn't happen for me. They'll get some nasal congestion as well. Many patients become very restless during the night, and they may like thrash around, hit their head against the wall. And I did that earlier on in my life. Right now, like I like to put a lot of pressure on my head. I'll like squeeze my head. I'll put like heavy objects on my head. And I used to ask my husband to stand on my head. He won't do that anymore.
Oh my gosh.
Because he doesn't want to hurt me.
Understandable.
But my first attack happened when I was 15 years old, and it was like in a math class in school. And I didn't even know much about headaches or headache disorders at the time. And like before that, I never even really had a headache at all. And my headaches were episodic at the time. That means like doesn't happen all the time. And I would experience these like long pain-free periods, and it would come without warning, and it would be very sudden and very painful. And then they would last for a few weeks, and they would go away for no apparent reason. So they're very unpredictable. And during my pain-free periods, I would just like to forget that it ever even happened. But when the pain would come back, I would like take aspirin. And since it came at night, I would take like sleeping pills just to hope that I would like sleep through the night, but it didn't work at all. And as I got older, I realized that the condition wasn't going away because I kept on having these cycles. And so I finally talked to my primary care doctor about it. And then that doctor referred me to an ear, nose, and throat doctor. And then I was treated for a sinus infection that I didn't have. So, like, then that didn't work. And so I had finally like started visiting their emergency room because it's so excruciating. And then they gave me an MRI, and I seriously wished it was a brain tumor at that point, because like at least I'd have an answer. And I didn't have a brain tumor, and I was kind of concerned. I was like, what's going on? And so I didn't have any answers or anything like that. So I like did my own research in a library. And at that time, there's like really no internet. I mean, there was internet, but there wasn't like a lot of information on the internet. And so I went to like my local library, and there wasn't even a lot of books out there, but there was like a book on neurology, and it was like a fat book without like a nice cover on it.
Oh no.
I did find like a chapter on neurology and headache disorders, and I had to, and there's no colored pictures or anything nice, but I did find a chapter on headache disorders, and it described my pain like perfectly. It described like the piercing, like the hot poke in your eye and the axe in the head. But it did mention that it happened to just men, male smokers. So like, I'm not a man and I didn't smoke at the time, but I still was like convinced that that described me. And so I went to my doctor and said, you know, I described that headache, and I'm not sure if I brought in the book or not, but I said, like, this is what I have. I'm very convinced that I have that. And the doctor was a neurologist, and he prescribed me this medicine called like Stadol nasal spray. And unfortunately, it contained narcotics. And I took that for a while. And then that wasn't good because it left me like very out of it. And I didn't even know that like that it was an addictive medication.
Wow. That sounds like such a long winding road. And those headaches seem so far beyond like a normal headache. I think to someone who hasn't experienced that, sounds like so like many levels beyond like a traditional headache. And they seem very difficult to treat. What kind of processes did you have to go through to get something that works for you? And did you eventually have to see a specialist?
Yes, I did. Like beyond that first neurologist, so there's like no cure, and like, but most of the preventative and abortive treatments have been around for a while. But some of the abortive treatments I can't tolerate very well. There's like sumatriptan and like the injectables. I used to take them all the time, and then they increase your heart rate.
Oh.
And then some of the preventative medications kind of like impair your cognitive functioning, and they also affect my speech pattern, and I have like word retrieval problems, especially when I'm really nervous, probably like right now, and memory issues. They give me like some short-term memory issues. So sometimes I'll put some food in the freezer or refrigerator that shouldn't be there, especially like under stressful situations. And it makes public speaking very difficult. But I'm always willing to try like anything new, like to advance the science. So it's like, it was maybe several years ago that I was part of a research study at Diamond Headache Clinic. And I think they did it at other locations too, where I had an implant in my cheek, which, where you held up a device up to your cheek that stimulated the trigeminal nerve. And I actually had surgery to have it done. And it was only moderately effective for me. So and the company went out of business too, I guess, because there was no longer funding for it. So I had to get surgery to have it removed. A couple of years ago, like a lot of new preventative treatments came out. I think it's about 3 years ago. Like I think that's Emgality, Aimovig, and Jovi. But I take Emgality, which is a once a month shot, and that has decreased the number of attacks and severity, which has been promising for me. I still get them, but it's been like kind of a game changer for me, to some respect, that I'm able to not have like these ones that soar to like what I call a number 10. I still get those, but it's like not every day. And I don't wake up at night anymore.
Awesome.
Yeah.
That's really good.
Yeah. And I also use ice packs a lot.
Okay.
Guided meditation. So these
I love
other
that.
things are not medications.
Yeah, that's really good. And also, just like side note, as far as public speaking goes, very well spoken so far in this interview, like doing very good.
Thank you.
So definitely nothing to worry about there. And I did want to ask, in your experience, did you find it difficult to navigate the healthcare system to get the treatments that you needed? I know we've sort of touched on that a little bit already.
Yeah, I guess my greatest difficulty, like I said, was in the early phases that I had to actually research it myself. And
Mhm.
I'm not really sure if I would have, if I didn't dust off that book in the library and find it myself, I don't think I would have gotten the diagnosis at that
Mhm.
age. I think it would have been much later. Um, uh, I know others were like, diagnosed at different ages that I know. So I think that would have been problematic. And I worry about like my future when it comes to healthcare costs, because I'm 53 right now and I'm actually like disabled due to the condition. And so I'm kind of really worried about healthcare costs, because the medications are extraordinarily expensive and they're
Mhm.
not covered. Some of them are not fully covered by Medicare and Medicaid. And some people use what's called high flow oxygen therapy. I don't use that myself, but for many people that is not covered by Medicare or Medicaid. So, and it depends on the state that you live in. So
Mhm.
that I'm really concerned about for some other folks that I know are grappling with this condition.
Yeah, that's really difficult. And as a patient, having experienced what you have, sort of in the same vein, what would you like to see changed about the way patients are treated by their doctors, especially in a condition that's unusual, like cluster headaches?
Like I do understand, like after watching like all these kind of doctor shows and how they diagnose and treat patients with rare conditions, that it's a process. You have to eliminate a lot of things. And so it is, it is possible to get a wrong diagnosis. But when a patient like reports like no improvement, I feel like it's really important to keep asking questions. And if there's uh, a patient who receives like no relief from a treatment, like I did initially from the ear, nose, and throat, you have to refer them to someplace else.
Mhm.
And maybe I didn't follow up. I can't really remember. I may have just gotten really frustrated at that point. Um, and I think that patients need like a doctor's expert of advice of where to go next if the treatment fails. I would also see like less wait time at appointments. Unfortunately, these specialists are rare to come by. I do appreciate the specialists that we have, but like often you have to wait a month or two to get an appointment.
Mhm.
And for pain medications and medication refills, like when you're in pain, I really like to see that the medication is refilled as soon as possible, and also to have like really polite secretaries.
Yes.
Secretarial. I haven't always experienced that, but very fortunately, I have a great doctor right now that if I call in for like a script or anything like that, they call me back within 24 hours. And sometimes I'll have to get like an emergency, like nerve block, and they'll schedule me in for an appointment because they also service people with other types of headache disorders. So I think I'm not sure. I think they prioritize cluster headaches. Maybe that's just in my head, but I think that doctor understands that pain is on a whole different level.
Yeah, absolutely. Yeah, that I mean, all of that sounds amazing. And it's really important to have access to resources like that you can get help in 24 hours. That I can imagine how instrumental that is to like feeling good on a daily basis.
Yeah.
Um, and sort of going on to like a different note, besides the pain, how has this disease impacted your life? And sort of going even further, what suggestions do you have for other people who suffer from cluster headaches like you?
Um, what I felt in my life, it's not only just the pain, it's like it's been so isolating as a condition. And like I've had to cancel so many plans, just like
Mm.
with friends and just even like, with the relationships that I have, like it affects my home life because, it's like, oh, suddenly, oh, I can't make dinner tonight because the tax coming on, and because of the extreme pain. And it's for many, it's like hard to maintain employment, or if you are employed, you're, calling in sick to work frequently, or you're not performing well due to lack of sleep because it's interrupting your sleep cycle. And for a lot of people, it affects like travel plans because it upsets your circadian rhythm too, because if you travel, it will set off a cluster cycle. And also because the medications, you have brain fog too. So there's that component. And I feel like we're misunderstood in respect, like if you say I have a headache, a lot of people associate that with migraine. So, if you say, hey, I have a cluster headache, people will try to be empathetic, but they think it's a migraine, where it's just something totally different. Like I was a teacher and I'd be like, oh, I have a headache, I need to leave the classroom. And someone would be like, oh, can you wait a half an hour? It's like, no, I need to leave right now. I can't handle it. So it's that kind of stuff. And for that reason, I feel like it's extremely important to like have your own kind of community. And I think that's probably the same with any type of rare disorder, or maybe just any type of disorder, just like to be able to connect with people that have your same condition, because it could be so isolating, and people just, you feel like you're different. At least I felt that so like earlier on, like for so many years, I felt like I was the only one that had that. And so I did find a group called Cluster Busters on the internet. And then I thought there is like a lot of groups on Facebook too, where people kind of communicate on the web, and they get ideas for new treatments, and also just the community of being able to like joke about it, your disorder. And that I find that, no, sometimes I haven't found humor in what's going on. So I really like the community aspect. And we've even traveled to come and see each other locally to Chicago, which was really, really nice, just to even face-to-face meet people that have it, which was really, really cool.
Yeah,
So,
that's so important, and honestly so eye-opening, because I think before, preparing for this interview, if someone had said a cluster headache to me, I would have been like, oh yeah, like a migraine. Like this is very eye-opening, and I think like being able to find a community and people who truly understand what you're going through is so important. That's amazing that you were able to find that.
yeah, it was really great. I think of all things, that was like the best, was being able to connect with people,
Yeah,
And,
absolutely.
yeah.
And that's my last question for you. So before I sign off, do you have anything else you want to sort of leave the audience with?
No, I would just say, like, you really just connect with people that have the same thing that you're going through. I think that's really super important. So just feel that you're not alone in this.
I love it. Thank you so much, Elizabeth. It's been a pleasure.
Thank you for the interview.